Hello, everyone. Um, Welcome to the debriefing on NGR 6365, Family Nurse Practitioner Practical 1. Today, we are focusing on assessment in primary care patients with reproductive disorders. So, on the oral debriefing today, my oral debriefing today is on a 26-year-old female patient who came to us with a chief complaint of painful sexual intercourse, which is known as dyspareunia. In evaluating a patient with dyspareunia, both subjective and objective evidence should be considered. In this case, the patient's complaint of pain during intercourse raised suspicion of pelvic floor dysfunction as a possible underlying cause. Some assessment tools was used. So the most appropriate tool for assessment was the pelvic floor examination. During this bimanual internal examination, sensitivity was noted in the pelvic floor muscles, a common finding in patients with pelvic floor dysfunction. So this method helped me identify the source of the pain and determine how to manage it effectively. In the future, I would incorporate the Markowski pain scale to measure and assess pain intensity during the exam and monitor changes over time. Measuring pain intensity is crucial in managing both acute and chronic pain, as the information obtained is more accurate and leads to more effective patient care. Summary of relevant data participants. The summary data participant subjects, which is the patient, experience showed an increase in penetration pain with burning sensation over time. The patient history, coupled with a comprehensive pelvic exam, indicated dyspareunia caused by pelvic floor dysfunction. The patient's emotional status also came up, and this was crucial in determining the next steps after considering that dyspareunia has significant emotional, physical, and psychological implications. So the physical examination further corroborated sensitivity in the pelvic floor muscles and did not uncover further dysfunction of the genitourinary system. So reflection on the data collection. The data collection process was comprehensive, including the history of the present illness, sexual history, review of systems, and assessment of physical complaints with a focus on the pelvic area. I found the process efficient in narrowing down the differential diagnosis. Using the pelvic exam as the primary tool was beneficial, as the dysfunction was localized early on. However, using a validated questionnaires on sexual function, such as the Sexual Function Questionnaire and the Female Sexual Function Index, may provide more detailed information in future cases to quantify the extent of sexual dysfunction across different domains. The sequence of collecting subjective and objective data was reasonable and provided sufficient information for treatment. By addressing the physical, mental, and psychological aspects of the patient's condition, the plan of care aimed to reduce pain and improve her quality of life. So, topical treatments, counseling, and pelvic floor physical therapy were selected as first-line interventions supported by current evidence-based guidelines. This combined approach of physical therapy and sexual counseling is expected to help the patient become more comfortable with her sexual well-being. So as always, after seeing the patient and with all the information given to her, she was also encouraged to follow up in 2 weeks' time if the condition persists. So that's the briefing on the patient with the diagnosis of dyspareunia. Thank you for listening to the oral debriefing. I hope you guys are interested. Thank you so much.